Dr. Dan is here to answer some of your medical questions.
And tonight we're talking about pregnancy complications, including pre-eclampsia, and a new study out about that. So tell us a little bit about, first of all, pre-eclampsia.
Sure. Pre-eclampsia is probably the big reason. Women have to come in at the end of the pregnancy every week, every 2 weeks, because preeclampsia is probably the most common bad thing that can happen. It's a high blood pressure disease. It's actually a vascular disease where the total body systems are affected because of injuries to the vascular system. So the kidney and the brain and the placenta and the liver and the bone marrow, you can get manifestations of preeclampsia. The reason is because the mom is different from the baby, so there's a reaction that goes on. It goes away immediately after the birth of the baby. So it's just something we have to look out for.
And then tell us a little bit about what this new study says about
Well, the new study shows that there was a protein, placental protein, and that predicted very well that patients would develop preeclampsia by 35 weeks. Well, that's important to know because when we see patients who are going to get preeclampsia, we don't want them to get it before 35 weeks because then they have to be delivered and they have preemies. So if we can find patients who aren't going to get them, we can actually decrease the number of visits as well as, so it will cut down costs of pregnancy and cost of visits at the same time finding this disease. Now, right now we find it pretty well because patients have to come in every week or two and we can see it happening.
Now, is that, though, difficult for the mothers? What this study is saying basically is those visits would be reduced? We
could decrease them if we saw that the patient wasn't at risk, because you don't really know until it starts to happen. So we need patients to come in so we can see it, because patients aren't going to get symptoms from this at first. They'll start getting high blood pressure and have a condition called proteinuria that we can pick up weeks before they get symptomatic, which the main first symptom is a really bad headache.
Okay, so something pretty common.
Yeah, it's pretty common. Other than preterm labor, it's the number 2 complication of pregnancy.
All right, good stuff. Thanks, Dr. Dan. And Dr. Dan joins us each Monday to answer your medical questions. If you have a question, you may write or email him at the addresses on your screen. You may also post the question on our News 10 Facebook page. We'll be right back with more News 10 at 5.